A very warm welcome to you all to the one-on-one set. Tonight we are going to dive into a subject that concerns a lot of athletes, sports medicine. It is in fact an area of medicine that focuses on preventing and treating sports-related injury. In the studio tonight, we have with us Dr. Adisha Bholah, who is an expert in this field, and she will talk to us more about the role and importance of sports medicine. Dr. Adisha, thank you so much for joining us in the studio of the NBC.
Thank you, Koya. Thank you for inviting me. I'm very privileged to be here tonight.
Adisha, you've been practicing sports medicine. You're in this field for a few years now, and it's a field that's relatively new in Mauritius. Share with us about your experience in this field and what is it exactly about sports medicine.
All right, to start with, we tend to say that sports medicine is new. It has been here for quite some time. So I've got colleagues who have started with it at the sports medical unit now, I think 30 years back, if I'm correct. But I am quite, I'd say, relatively new to this in the country. It's been around 10 years that I've been practicing sports and exercise medicine and graduated actually like some 11 years now. Yeah. So it's been a very good journey, I must say.
And how do you see it in Mauritius? How do you see its popularity? Do you feel that it's something that's talked about?
Not really, to be honest. Sports and exercise medicine is seen to be, just like you said, athletes focused. There is this field, yeah, of course, sports medicine is athletes focused, but there is this aspect of public health, which is sometimes and seldom, forgotten about. So we as sports and exercise medicine practitioners do have a responsibility towards the athletes, but also have, the responsibility of the public as well. So it has been quite not well known, but we tend to see, an increase in popularity in sports and exercise medicine these couple of years. Yes.
Like we've said earlier, sports medicine, it's about, treating injuries related to athletes, but it's not only about that, right?
Yeah.
Anyone who practice sports, it's not necessary to be a high level athlete, to beneficiate from sports medicine. Talk to us about the concept exactly.
All right, so sports and exercise medicine, the concept dates from quite, years back, dating from the Olympics, to be honest. So it, like sports and exercise medicine can be open to athletes. And even in athletes, there's a lot of category of athletes from amateur to the elite athlete. And treating the amateur athlete would be quite different from treating, the elite athlete. There is also now a sub-branch of sports medicine, of what we call performance medicine, which is very, very focused and oriented towards very high level athletes. Those who are going to be on podiums for the Olympics, going to be treated quite, I wouldn't say treated. Treated is not the right word. So are going to be more focused, more energy, energy focused towards performance compared to what we would consider treating an amateur athlete. Yeah.
So how's it different, the treatment for amateur in sports? Is it in the duration? Would you say that?
So the big difference is in the athlete itself. Different kinds of sports are going to have a pool of different types of injuries, different types of expectations. But what is most important is that in a professional athlete, the amount of time that athlete is going to dedicate towards sports, towards physical activity, preparation for his competition, is much, much more compared to what an amateur athlete would put in. So obviously the spectrum of disease and injuries is going to be different, and the amount of dedication that the whole sports medicine population is going to have towards that athletes needs to be different.
Sometimes people tend to confuse sports medicine to physical therapy. Is it exactly the same, or is it like, a sub branch in it?
So physical therapy is a term which could be interchanged with physiotherapy.
Okay.
right? So sports medicine is something different. Even between physical therapy and physiotherapy, there might be differences, but we tend to use physical therapy as a more Americanized type of vocabulary instead of using, physiotherapy. And physiotherapy tends to be more of European, and Australians also use the same dialect. But these two tend to be, I mean, they are very different from, what a sports doctor would actually do. A sports doctor has a different background to be to start with. They're going to do like sports, general medicine, practice emergency medicine, and then specialize in sports medicine. So the career pathway it itself is different. While physiotherapy or physical therapy tend to be more of a manual kind of therapy, it is basically, if I can say, helping the sports doctor in delivering sports medicine.
Adisha, you've said earlier that you've been in this field for more than 10 years. So, what pushed you to be in the field of sports medicine? Were you always interested in sports or somehow happened randomly?
Um, all right, sports medicine for me was something quite fancy at that time. So it wasn't when I went to that specialization. I was expecting what was expected out of me, but I'm more actually amazed from where it actually brought me than where I actually started with thinking I would have been. So initially, for me, sports medicine was about the glory, about, working with teams and also traveling around. But
Okay.
to be honest, when I look back at it now, I think sports medicine has brought to me a lot than I have brought, to the practice here in Mauritius. It is a very challenging job.
I imagine, yeah.
Yeah, it is challenging. You have to travel. You need to be present for the athletes, and especially for a woman. Sports still tends to be a quite male-dominated area, male-dominated field, and for women, it's quite difficult. I mean, difficult is not really the word. So, it's challenging.
You have to strike the balance. You need the
Yeah.
perfect balance in your personal life, your professional life, and you need to find your place in a field that's, you know, dominated by men, we say though.
Yeah, yeah. But I've been quite lucky, I must say.
Yes.
Mauritius has a very good support structure regarding women, especially women in sports. It's not the same when I see my colleagues back in Africa. So I must say I've been very lucky to have people who've always been behind me, and pushing me towards perfection in sports medicine. Yeah.
Do you feel that's also a huge responsibility? Because, like, the athletes, you have them, you need to treat them, and they're going to represent the country. So does it feel like a responsibility sometimes?
Yeah, it does. It is. Whenever you take a job, you do have the responsibility of acting upon it. So, yeah, I must say it is a huge responsibility, but the responsibility not only lies in you. It lies on the whole environment around the
Yeah.
athlete. So creating that environment, keeping good relationships with the athletes, with the coaches, with the SNC coaches, and the whole environment support that we create around the
Yeah.
athlete is
It's important to
important.
have that understanding, right? For things to move smoothly.
Yeah, yeah. So what we tend to do is create what we used to call before a multidisciplinary team around the athletes, to to cater for and take care of the athlete. But now it's moved to multidisciplinary to cross-disciplinary. So we actually need to be very interconnected and know what's actually happening behind the door of the psychologist, behind the door of the nutritionist, to be able to better care for the athlete.
Adisha, one of the primary role of the sports medicine physician in competitive sport is the comprehensive health management of the elite athlete to facilitate the optimal performance. So how can that be achieved?
Um, just like I mentioned, you need an athlete environmental support, and this is created by having multidisciplinary team, and also working with what we call the high performance team. So the analogy that I can give is the one that we have currently at Godot. So we do have the high performance center, and we
Okay.
do have the medical center, which is called the National Institute of Sports Medicine, working very closely hand in hand together around an athlete. That working together, I think, is the key and the most important thing, most important factor towards, being productive for the athlete.
And also at the training session, the coaches always focused and rightly so on the specific and objectives of the training. But on competition day, the focus is on the performance, on the delivery. So, what are the lifestyle choices that an athlete should make in order, to be really at their best on the day of competition?
I think that's a question which would probably have a lot of answers. An athlete should, of course, be focused towards the sport.
Consistent, right?
Yeah, consistent
Consistent.
is one thing, but I think discipline is the most important
Yes.
thing. They should be, resilient and have a lot of characteristics of what I call a disciplined athlete. We do have a plethora of athletes in the country. Each and everyone have very different persona, very different personality, but I think the most important thing is again the discipline. We used to say before that athletes were born, but now it's completely changed. Athletes are trained, are made. Athletes do, of course, have some predisposing factors like good genetics and a good environmental support, a good family support. Being lucky to have grown with an environment where sports is achievable to them. But what is more important is the discipline, the resilience in
Yeah.
the environment that
Environment
makes you
where
an
they're
athlete.
growing,
Yeah,
they're actually working
yeah.
towards their dream, right?
Hmm.
But beside that, I think they also need the adequate fuel to maintain their level of performance. And
Hmm.
here comes their nutrition,
Hmm.
right? So how does nutrition impact on an athlete's performance? And does sports medicine actually have a role in that?
Yeah, so nutrition is very important, like paramount importance in performance. We do not have studies who actually back up, the percentage of how much nutrition is important in achieving medals or high performance, but it is one of the most the basics of basics building block of an athlete. So you mentioned, of course, carbohydrates, proteins, in fat and micro minerals like vitamins and everything. What is more important again, and we tend to forget that, is water, and that also is like very important aspect of being disciplined. Again, coming back to the discipline of the
Yeah,
athlete.
it's very important in sports. This
Yeah.
means everything, right?
Yeah, yeah, and nutrition again, is very important. Sports medicine, one of the multidisciplinary, approaches that we one of the components would be nutrition. Yes.
And yeah, exactly. So does it differ, the type of nutrition for different athletes, even if they are at high levels, but concerning their discipline maybe?
Yeah, of course. Every discipline, every sports discipline is going to require a different energy consumption. So depending on the amount of output we're having, depending on the usage of the energy systems, also we're going to fuel the body differently. But in general terms, athletes would consume a lot of carbohydrates, moderate amount of proteins, and a lot of water, low in fat. Yeah.
You mentioned earlier about, psychotherapists, and sometimes we tend to forget that the mental health is also an important aspect in sports, a very crucial one, in fact, because it's all about, having the right mindset, the right strategy. So share with us about stress level management, how can it impact on an athlete's performance?
Yeah. So mental health in athletes is as a whole, whole different subject. I could speak about probably hours around mental health in athlete. But what is more important, is having the basics right. So normally, a high level athlete would be a resilient athlete. So resilience is something that we were actually looking for, and of course, having all the positive. Being positive minded and being focused is what we're looking for.
Do you feel that there is, an awareness about mental health in sports in Mauritius, or there's, the work is going to come?
Yeah, so mental health is something that we're working towards. It there hasn't been a lot of limelight, of course, around mental health, and it stays still a taboo subject in the country. But we're seeing more and more people now open towards speaking about their problems and facing them and then trying to find solutions around them. Also, the network, the environment being accepting that these are things that we should actually work on. We're also seeing changes in the environment, in working positively towards that. For instance, at Kodo, we do have a part-time psychologist helping in, and we see more and more coaches, being involved now with that aspect of performance.
Adisha, most of the athletes, high level athletes, are also, working, and then they, practice their sports just like many people.
Mm.
So, what is the correlation between sleep and an athlete's performance?
Sleep is very, very important for athletes' performance. Why? Because it is I think, one of the major factors of bringing in recovery. And as we know, recovery is extremely important in attaining, performance. We used to think in the past that, if you would train hard, you would probably attain your gains. But now we tend to think about training smart. And recovery is something which is very important. It is a very important, key that you would use in planning your cycles, planning the whole training cycles. So sleep is extremely important. If I take the examples of, for instance, Roger Federer and like very high level athletes, they are very disciplined towards their sleep. Some athletes even sleep around like 10 hours, and are very religious about that. So for me, and I think for the whole, on behalf of the whole team I work with, we do lay a lot of importance on sleep.
And how do you see the development of sports medicine throughout the years in Mauritius? And what are the changes maybe you want to bring in the perception of it?
So it was quite challenging, to be honest, to kick off with sports medicine in the country. The perception has been quite different. I remember I've been told that, oh, sports medicine it's a branch of orthopedics. Oh, you only prescribe NSAIDs and that's it, right? I was like, it's not only that. We tend to see a change in mentality nowadays. In the past 10 years that I've been here, I think sports medicine in itself have had a lot of limelight. When I started working in here, I think I can count on my fingers the number of colleagues I had. But now I'm happy to see more and more doctors and physical therapists and physiotherapists, and the whole allied healthcare professional colleagues,
Yes.
being interested in sports and exercise medicine. Now we can actually think about having, a high performance center. We can think about having a National Institute of Sports Medicine. Exercise prescription, is kicking off. We also have a Sports and Exercise Medicine Association. So it's changed a lot. It's evolved a lot, and I'm very optimistic about sports and exercise medicine in Mauritius, and especially because we are quite we are on the plan, on the map, on the African map. People see us,
Exactly.
and the community is becoming stronger, and I'm very positive about that.
We are actually drawing towards the end of this episode, but before that, Adisha, talk to us about some of your future goals now.
My future goals. So, uh, one of my dearest goal is to place Mauritius in the limelight in sports and exercise medicine in the world. Um, I think it is achievable. It's going to be quite tough.
Yeah,
Uh,
nothing is impossible though.
like you say, nothing is impossible, but I think we can definitely make it.
Definitely.
Yeah.
And before we let you go, any message you would like to share to our youngsters who are watching you right now? Someone you know who wish to be a high level athlete. So, what's your message to them?
Be disciplined. Start by being disciplined. Discipline towards your training. Discipline towards the whole environment around you. You, your coaches, your family, and of course, you do have a support system around you. Just be aware of that and reach out. We here for you.
Thank you, Adisha. It's been a delight to have you on the set tonight and learn more about sports medicine.
Thank you. Thank you very much for having me here.
Dear viewers, we have now come to the end of this episode. Thank you for your time. We hope to catch you next week at the same time, same channel. Have a great evening.